So in prior segments, we covered conformity and compliance. And in this segment, we're going to pick up with persuasion and obedience. So the third type of influence is persuasion, trying to get you to change your mind about something for which you already had an opinion. Notice the increasing pressure from conformity and expectation to compliance, a request, to persuasion. There are two routes to persuasion based on two modes of thinking. The central route is more logical, and it involves careful, logical thought where persuasion depends more on the quality of the arguments. But we don't always slow down to think about things carefully, right? The peripheral route is a faster, less thoughtful mode of thinking, where persuasion depends more on superficial peripheral cues, such as thinking more highly about a product because it comes in an attractive package. Here's a little quiz to see if you can identify central and peripheral cues. So practice with this. The following features of a food product would appeal to which route of persuasion? Pause the video after each one and answer peripheral or central before turning it back on. Attractive model, that would be peripheral. Colorful packaging, that would be peripheral. Nutritional information, that would be central. Rhyme in the slogan, that would be peripheral. Health benefits, that would be central. Celebrity endorsement, that would be peripheral. Contents, that would be central. Catchy slogan, that would be peripheral. Taste, and that would be central. Toy prizes inside, and that would be peripheral. All right, so hopefully you have a nice grasp on that. And here's a fun challenge. Pause the video for a couple of minutes and see if you could come up with a public safety condom ad using at least one central and one peripheral cue. And now we're moving to the highest pressure of all, obedience, a response to a command. Obedience is the last and most coercive of the major types of social influence. And the most famous classic study of obedience, do you know who that was done by? It was done by Milgram in 1963. Hopefully for many of you, this is a review from Psychology 101. Participants in this study were all ages and occupations. They believed they were participating in a study on learning through punishment, and that they were randomly assigned the role of teacher, while another older man was assigned as the learner. They watched the learner get hooked up to electrodes in another room, then were taken to the teaching room and the switchboard, which looked something like this. They were assigned to attempt to teach the learner items over a microphone and to administer a higher voltage shock each time the learner got one wrong. The voltage buttons at a certain point were labeled with warning signs during which the learner would cry out in pain, and final, extreme danger, severe shock, at which point the learner would beg them to stop, claiming to have heart problems. If participants looked to the researcher, he just said, the study must go on. The big question here is, would any of the participants shock all the way to extreme dangerous levels? In fact, approximately 2/3 of them did. So remember this, approximately 2/3. Don't get this mixed up with Ash's famous conformity study in this lecture, right? Where it was 1/3 that conformed. In what we'll refer to as the nurse study, several nurses were called by a man they had never met, but who identified himself over the phone as the doctor of a patient on their floor. He then ordered them to give twice the maximum accepted dosage of a drug to that patient. The order violated hospital regulations. The dosage was too large and the effects could have been harmful. Yet, 21 of the 22 nurses had to be stopped as they were actually preparing to obey the doctor's orders. Between 1995 and 2006, a scandal appeared in the news. 70 fast food managers across the country were called by an individual posing as a police officer who described a generic female employee or customer. Once the manager identified someone fitting that generic description, the man gave escalating orders to interrogate, then restrain, then strip search the young woman to check for stolen property. One Taco Bell owner in Arizona even obeyed orders to do a cavity search of the alleged female suspect. Now, in some extreme cases, people have even obeyed orders to take their own life. As you can imagine, such influence would take years to establish and would involve many escalating techniques. A notable case is the Jonestown mass suicide. Reverend Jim Jones owned a church in California in 1965, which proclaimed diverse, loving values at a time when many in this country were yearning for this. The church membership grew rapidly, and the members became so devoted over time that they formed their own community, and many member families moved there, turning over their money and working within the community. Reverend Jones eventually convinced his members that he could give them all a better life if they moved to Jonestown in South America. Almost 1,000 did. When a U.S.-based investigation ensued, Jones convinced his people to commit a mass suicide by drinking Kool-Aid laced with cyanide.